we must applaud the leadership of the continent in getting itself rapidly organized very early on when this outbreak happened.
That is Dr. John Nkengasong, the director of the Africa Centers for Disease Control and Prevention, speaking about what African leaders are doing to mitigate the consequences of COVID-19. Hello, I'm Ayan Bior. Welcome to Our Voices. This week, we're offering a COVID-19 analysis as we take an in-depth look at how African countries are handling the pandemic. You'll hear more from Dr. Nkengasong coming up in a few minutes. And you'll also hear from the former president of Mauritius, a country that is defying the odds as it battles the virus. Here's a sneak peek of that conversation.
Across Africa, the projections that had been made initially, they haven't materialized, which is a very good sign. Is it because Africans are getting more resistant? Because, Africa, we've had our dose of infectious diseases and pandemics, and we've had Ebola, we've had Zika, we had all sorts of these crises.
Well, I'm certainly looking forward to hearing more from Amina Garib Fakim later in our program. Now, what other countries are showing progress? Which nations are struggling? And what can we learn from them as others begin to see a surge in new cases? We'll have these conversations and more coming up on Our Voices. African nations are having diverse experiences coping with the coronavirus pandemic. Some appear to have the virus under control and are beginning to lift lockdowns, but the progress is uneven. My co-host Ariane Itangishanka gives us a continent-wide look at the pandemic with reporting from VOA Southern Africa correspondent Anita Powell.
The coronavirus, medical experts like to say, doesn't care about borders or language or any of the cultural aspect of humanity. It just says targets. But since the virus hit the African continent months ago, it has taken a very different course in different countries. As of June 22nd, there were over 306,000 confirmed infections and 146,000 recoveries, according to the African Center for Disease Control and Prevention. The continent recently hit 300,000 positive cases, but they've spread unevenly. South Africa leads the continent with more than 97,000 infections, and it continues to rapidly grow. Meanwhile, countries that have previously spared with epidemics, like Rwanda and Uganda, are reporting cases in the hundreds. Dr. Matshidiso Moeti, the World Health Organization Regional Director for Africa, says the organization is training more than 10,000 health workers in an attempt to decentralize the response to deal with these different realities.
One of the biggest challenges we face in the response continues to be the availability of supplies, particularly test kits, and this is due to disruptions in the global supply chain.
And in the East African nation of Uganda, which has yet to report any death amidst its fewer than 300 cases, Health Minister Dr. Jane Acheng says their health system is already well fortified due to other lethal outbreaks like Ebola. But the lack of medical supplies is still worrisome. According to Reuters news agency, Uganda only has around 100 ventilators for a population of almost 43 million. But some Ugandans are doing what they can to help fellow citizens, including this Ugandan car maker who teamed up with engineers from a local university to build a low-cost ventilator.
Ventilators are very expensive pieces of equipment, and in Uganda we only have about 100. So how we realize that if numbers keep growing globally, there will not only be a lot of competition for these ventilators, but then as a high-end product, we may not be able to get more that could meet our demand here in Uganda.
Now to West Africa, where Ghana has one of the highest number of COVID-19 cases in the region with over 10,000 infections. But it has begun a phase of easing of restrictions put in place in early March, according to Reuters. There's one company in Ghana that is hoping to ease tensions as the nation tries to find a new normal. INCAS Diagnostic is working on a rapid antibody test kit and hopes to get it approved by regulators by the end of next month.
You screen a particular community and realize that most of them are at risk. Most of them do not have the antibodies, then it means that those people are likely to have an outbreak if you are not very careful. So you can put in measures in place in those communities to help.
Earlier this month, Moeti noted that only a handful of countries are contributing to 71% of cases across the continent, and major cities will have to continue to practice public health measures like social distancing in order to slow down the spread.
In most African countries, the virus entered through the capital cities. So it was through international travel, particularly people traveling in from Europe. And as far as we know, it has not yet reached in significant numbers those areas where we tend to find refugee camps or camps of internally displaced people. But we've certainly done the work with our partners to prepare for that.
Moeti says that cases in Africa remain lower than other parts of the world, and that one thing holds truth across the continent. The virus doesn't let its guard down in its quest to survive, and so she says we shouldn't either. This is Oriani Tangishaka for VOA Our Voices, with reporting from Reuters and VOA Southern Africa correspondent Anita Powell.
Thank you, Ariane. Well, there's been a lot of progress across Africa, but not all countries are drawing overwhelming praise. Let's take a closer look at two countries from opposite ends of the continent, starting with Tanzania, where President John Magufuli declared his country free of COVID-19. But critics said, not so fast. My co-host Haiti Adams Fitzpatrick looks at Tanzania, where WHO officials are expressing concern over the country's approach to curbing the disease.
While many countries are being praised for their approach to controlling the spread of COVID-19, Tanzania is an exception. A lack of transparency in reporting cases is raising concerns. Despite pressure from the World Health Organization, Tanzania has not published data on the number of coronavirus cases in the country since late April. The U.S. Embassy in Dar es Salaam is warning that the risk of contracting coronavirus in Tanzania remains high and says the government has not released aggregate numbers in over a month. Despite that, President John Magufuli declared his country free of COVID-19. Magufuli has steadfastly criticized public health officials and the international community and has downplayed the importance of testing for the disease. And his government is dismissing criticism over its lack of COVID-19 infection updates. Kassim Majaliwa, Tanzania's prime minister, says there are other diseases like malaria and HIV that also have a high death rate.
Thank you, Haiti. From Tanzania, we go to West Africa, where VOA's Medina Maishanu reports doctors in Nigeria are demanding that the government provide doctors with more personal protective equipment and hazard pay in treating patients infected with COVID-19.
Doctors in Nigeria's state-owned hospitals on the front lines of the pandemic went on strike earlier this month to demand for protective equipment to help them safely do their jobs. The strike by the National Association of Resident Doctors, a group that represents about 40% of the country's doctors, was called off earlier this week to give the government 2 more weeks to meet their demands, according to the union. At least 10 doctors in Nigeria have died of COVID-19, the highly contagious disease caused by the coronavirus. Nigeria has over 20,000 confirmed COVID-19 cases and 500 deaths, according to Johns Hopkins University. VOA reports that the union has been criticized for calling a strike during the pandemic, especially while the federal government and many states are battling coronavirus-related economic woes. The residents' union had threatened the strike over multiple issues, including protection against pay cuts or dismissals in 2 regions.
Thank you, Medina. As many countries across the continent reopened their economies amid the pandemic, the head of the Africa Centers for Disease Control and Prevention urges widespread testing as the best way to avoid a surge in new cases of coronavirus. VOA Africa's Salam Solomon spoke exclusively to Dr. John Nkengasong, the director of the Africa CDC, about Africa's success stories as well as its ongoing challenges.
The Africa CDC was founded in 2017 and is the technical agency of the African Union. It works on monitoring disease outbreaks, improving the capacity of clinical testing facilities, coordinating a response, training public health officials, and more on-the-ground work. I recently asked its director, Dr. John Nkengasong, what has been the agency's biggest success in combating the coronavirus pandemic.
For Africa CDC, greatest success story for us has been that the pandemic has not taken up in Africa in a manner in which it was projected early on in January. And that is, again, a remarkable situation because there were many projections that outlined and indicated that the continent was going to be hit by a massive storm of COVID-19 and that will lead to many infections and many deaths.
As of this month, nearly 300,000 cases have been reported, according to the agency's daily update dashboard. But there's also been questions of accuracy of the caseload and the fatality numbers being reported by governments around the continent. Are they reliable sources of information? Dr. Nkengasong says leadership in times of crisis is key.
On February 22nd, the African Union Commission, under the leadership of Chairperson Moussa Faki, convened an emergency meeting of all ministers of health in Addis Ababa, and they agreed on the need to develop a continental strategy that is underpinned by the need to cooperate, to coordinate, to collaborate, and to communicate. And then, secondly, the establishment of a continental task force. Now, the reason that this is important, the question you just asked, is that we all agree as a continent at a ministerial level that we need to share information, share data, because we need to know our pandemic. If we do not know our pandemic, we cannot fight the pandemic. It's like we're at war. So I say this to underpin the point that it is now the obligation of all member states of the African Union Commission, all 55 member states, to be forthcoming with data on COVID on the continent and share it with the Africa CDC in a timely fashion that we can process it and then look at trends and use that to at least guide the fight. We are in for a very long battle. The key ingredients as the cornerstone of our strategy to win this long battle and very complicated battle is data, which we must have from the countries. Now, is the data that we are seeing accurate? Well, no data is fully accurate anywhere in the world. Okay, but we have to leave the possibility and reality that because we are not testing enough, we may be missing cases. Not may, we are certain missing cases out there. Because our surveillance systems are weak, our health systems are weak, we are certainly missing cases there. The real question is by how much? Okay, are we missing it by a whole lot, or are we missing a few cases here and there? So as we increase our testing ability, we'll be able to answer that question. The concern that we have is what we are not seeing going to harm. As I've said before, if you do not test, you do not find. So if what we are not finding are going to come back to haunt us, that is the big concern. That's a question that only time will tell.
And the biggest challenge in combating the coronavirus, Dr. Nkengasong says, is to remain vigilant and not declare victory too early.
So we are not yet at the top of the slope, or we are not decreasing. So I think that has to be put in context. And this implies clearly that we cannot be complacent as a continent. We have to enhance our ability to test people, trace those who are the contacts of those who are infected, isolate those who are infected, and then bring those who are infected to treatment. So I think we have to be extremely double efforts to make sure that the situation doesn't get out of hand.
Our thanks to Salam Solomon for sharing that conversation with us, and of course to Dr. John Nkengasong. Still to come, the World Health Organization projected 800 COVID-19 related deaths in Mauritius. The East African island nation was expected to have the highest risk of exposure in Africa, according to the WHO. So far, that has not been the case. After the break, the former president of Mauritius helps us understand how her country is beating the odds.
Is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation. Welcome back. You're with Our Voices, and we're looking at Africa's success stories and ongoing challenges during the global pandemic as we try to see what we can learn from them. And we want to know what you think. Join this conversation on Facebook, Instagram, and Twitter. Our handle is @VOA Our Voices, or send us a message on WhatsApp. That number is on your screen. We now take a look at Mauritius, considered one of Africa's most successful countries in combating the new coronavirus. But how are they doing it? Well, observers say the government of Mauritius responded early to the pandemic with stringent lockdown measures, and as a result, saw a drastic reduction in new cases. VOA health correspondent Lenore Madu spoke to Amina Garib Fakim, former president of Mauritius, about the country's approach to fighting the virus and lessons learned.
I think, we just adhered to what has been prescribed internationally when the first cases were detected early March. And there has been lockdown of the airspace, and the people coming in, they were quarantined. And because we have a free healthcare, so access to medicine was not an issue. And so we have adhered to the best practices all along. And people also have been quite disciplined. I must say that, initially, I must confess, it was not easy because all of a sudden your life has been completely transformed. And but, at the end, just people got to realize that we are talking about a new beast for which there was no prescribed drug as such, and people had to cooperate.
So lockdown has been lifted. Now people will go back about their business as usual. But you said something important. You said people were disciplined. So when we look to governments, when we look to leaders to take care of these issues, there is a role that communities, people, individuals must play to make sure that these measures can be implemented properly. Can you comment on that?
Yes, it works both ways. In as much as government have also, they have a responsibility of providing very clear guidelines and practical guidelines as well, because sometimes guidelines are, given, they are literally, very good academically, but when put into practice, it can be chaotic. And when these guidelines have been given in very clear and certain terms, and people have listened to it, and when people have not listened to it, I think the police has been there to actually ensure law and order and make sure that the guidelines were respected. So it was a kind of triangular kind of approach, and it was very much the carrot and the stick approach, which meant that, over the weekend, we've had lockdown lifted maybe earlier than we thought. So as of today, we can say that, we've got our freedom back.
So what would you say are the lessons learned from Mauritius for Africa and the world, really?
Well, first of all, I must say that, across Africa, the projections that had been made initially, they haven't materialized, which is a very, very good sign. Is it because Africans are getting more resistant? Because, Africa, we've had our dose of infectious diseases and pandemics, and we've had Ebola, we've had Zika, we had all sorts of crises. Is it that? Is it the discipline that have been adhered to by the public? I mean, I think it's a combination of all these together. Initially, I must say my concerns when we were listening to what the WHO was saying in terms of social distancing, in terms of washing your hands. And I was very, very worried because in some parts of Africa, this is impossible. I mean, how can you do social distancing when so many people are living in one room? When water is a luxury, and where even soap and, running water cannot be found. But keep fingers crossed that this will be okay for the rest of the continent. And very soon the COVID will be a very bad memory.
Some people have said that the country took very drastic measures to ensure that this type of success happened in the end. People were locked down, and then the economic impact has been felt in many other countries. What can you tell us in terms of economic recovery?
Well, as the people know, that Mauritius, we depend a lot on tourism, right? And tourism directly brings about 9% to the GDP. But if you look at the aggregate industries around, we are talking about 23%. So that has been more or less been wiped off for this year. And then we've looked at, the other sectors, agriculture, all the other sectors, which unfortunately haven't fared too well. And we have concern about what form this recovery will take. I mean, government is already voting a kind of economic package to save the industry, but how can we save tourism right now when the rest of the world is still in lockdown? Or if we have some form of tourism, it will not be till mid-2021. So what do we do for this financial year? This is a very, very big concern for us.
Our thanks to VOA health correspondent Lenore Madu and Amina Garib Fakim. Amid progress and challenges presented by COVID-19, many people across the world are eager to know what will happen in the next few weeks, months, and even years. And governments are just as eager to figure that out. But how do experts do that? Well, some are using statistical modeling. It's an essential part of trying to predict what's going to happen in the world. But models are only as good as their numbers and algorithms. And like science, are never perfect. Daria Degas has the story.
In the early days of the coronavirus pandemic, one predictive model run by London's Imperial College suggested the nation could suffer some 500,000 deaths by August. For the US, the predictions were even more shocking. They predicted up to 2 million casualties unless the government moved swiftly. Clearly, so far, the numbers are much smaller, but this particular model was just a theoretical way to determine who'll get infected and who will die if governments took no action. It's a simple tool, but epidemiologists can use models to predict all kinds of things. The main changing variable in these models is the quarantine measures. Scientists use the data on new cases before and after lockdowns have been imposed to fine-tune their models. Models help identify the so-called basic reproduction number, a variable that determines the average number of people that get directly infected by one sick patient during the whole period of infectivity. When it's bigger than 1, the number of infected people grows exponentially. The main challenge for this model, however, is the lack of data on the true number of those infected with COVID-19, especially since a lot of people seem to be asymptomatic. Scientists at the University of Washington got around this by creating a model that counted not the number of those infected, but the number of deaths.
We knew early on that we don't have enough testing, so we didn't know how many people are infected. And in order to be on the safe side, we decided that we start modeling once we have 50 deaths per location, so per country. And the reason we felt there'll be more stability on deaths. We're modeling a slope of increase, so that's a beta, it goes up or down.
This model remained the most optimistic for a long time until the number of deaths spiked in early May. Today, scientists predict 140,000 deaths by early August, twice as much as earlier predictions. The change in numbers is linked to easing of quarantine measures. Dozens of various models use a number of algorithms, but all of them have one thing in common. They warn against lifting quarantine measures too fast, too soon. Daria Degas for VOA News, Washington.
A fascinating look there. Well, after the break, we shift our focus to industries that are not only surviving the shock of the pandemic, they're meeting the challenges by providing a safer alternative to customers. That story when we return. Welcome back. You're with Our Voices, and we're taking a look at progress made in the fight against COVID-19 and lessons learned from success stories. Now, while the virus has sent shockwaves across business sectors all over the world, some companies and nonprofits are figuring out ways to help job seekers. A Virginia-based non-governmental organization called Computer Corps helps low-income immigrants master using computers in order to help them find jobs. Always fascinating to see how people are adapting to new norms. And people across the continent are adopting new ways of doing business in order to protect themselves, including hospitals, which introduced new measures to keep people safe during the pandemic. According to the UN Population Fund, many women say they do not want to be treated in health facilities for fear of being exposed to the virus. The situation is even more worrying for pregnant women. In Cameroon, an NGO of doctors introduced home consultations for pregnant women and other patients, the first in Cameroon. Moki Edwin Kenzika narrates this story by Anne Nzunki.
25-year-old Jeanne Gonner says she has a health condition that needs regular monitoring. But she hasn't been to the hospital for 4 months because she's afraid of being exposed to the coronavirus. Instead, a doctor from non-profit group SOS Doctors Cameroon is visiting her at home.
I feel safe at home compared to the hospital. When you go to the hospital, you don't know who you're going to meet on the way. The taxis you'll take, you don't know who is sick or not.
Medical experts say they understand this, but urge patients to continue to stay in touch with doctors and hospitals.
If there are initiatives that can add value, they should not be rejected. But I would like to say, in my humble opinion, I believe that the hospital is the best place where the diagnosis can be made and the patients well oriented.
The group SOS Doctors Cameroon includes 30 doctors in 5 cities. Patients can ask for a consultation on the group's website or Facebook page. A visit costs almost $34, twice the price of a hospital consultation. Despite the cost, requests for home visits have jumped from about 20 in March to about 100 per month now, according to SOS Doctors Cameroon.
We realized that it was mostly routine consultations. It gave us the idea to set up a remote assistance service, which is done by WhatsApp, to chat 24 hours a day, 7 days a week with a doctor, to ask any type of medical questions.
The demand is expected to continue. Cameroon has confirmed nearly 10,000 COVID-19 cases, one of the highest number of known infections in Africa.
That's good news from Cameroon, and that's all for our program today. On behalf of my co-host and the Voice of America, thank you for watching. Good day.